Yes, it is normal for your heart to beat faster when climbing a set of stairs or doing any workout. But if you had been feeling any weird and abnormal heart symptoms, then these can be the warning signs of a stroke in men and women. Stroke is one of the leading causes of disability in many countries across the globe. People most often don't realize that they have a stroke immediately based on just symptoms, which is why regular screening with a physician is extremely vital to keep your body strong and healthy. In reality, strokes in younger female have become increasingly common. Strokes is the third leading female killer in the U.S. When a person has a stroke, she is not getting enough blood for the brain. The lack of oxygen kills brain cells that are served by a particular blood vessel, and the body part, which is controlled by these cells, stops working as a result. In such cases, the person needs immediate medical attention to avoid chances of brain damage. Types of strokes. There are two types of strokes. Ischemic stroke. A part of the brain will lose the flow of blood. Hemorrhagic stroke. Bleeding starts within the brain. The risk factors for stroke include high cholesterol, smoking, diabetes, high blood pressure, old age. Sometimes there may be no warning signs of a stroke in men and women until it occurs. So high blood pressure, one of the most common causes of stroke, is called a silent killer. Learning the warning signs of stroke in females and males is vital to minimize the consequences and life-threatening events. How to identify the early signs of a stroke. It is essential to recognize the early signs of a stroke in men and women, and thankfully, there are some easy ways to do so. FAST will help you to identify the signs of a stroke quickly. A transient ischemic attack, TIA, or mini-stroke also can occur. TIA are called mini-strokes or pre-strokes since signs of a mini-stroke in women and men are the same as strokes. Mini-strokes might last up to 24 hours. Face drooping. When the person is asked to smile, the smile may look uneven and one side of the face goes numb. Arm weakness. One of the arms will feel numb or weak. Speech difficulty. The affected person may find difficulty in speaking and can sound slurred. Time to call help. If a person shows any of the following signs, call for medical help immediately. Early warning signs of a stroke in men and women. Pre-stroke signs in women and men are same as strokes. Often, the person may observe multiple symptoms, which include 1. Loss in motor functions. When someone is having a stroke, the brain-specific part, which lacks the flow of blood, will stop working. A person can lose the function of an arm or a leg and even find it difficult to speak. 2. Body weakness. If you feel sudden weakness in your body without any apparent reason and lose a sense of coordination, these can be warning signs of a stroke in men and women. It will happen suddenly and will be noticeable. In such a case, do not delay getting medical help. 3. High blood pressure. Keep an eye on your blood pressure. Increased blood pressure can be fatal to your life. High blood pressure is linked to many heart illnesses and strokes. If you see a change in your blood pressure, consult a doctor and go for appropriate medication to reduce the risk. 4. Drooping face. If you suddenly feel that your face has gone numb from one side and is drooping, remember FAST and call for a physician immediately. Do not take this sign lightly. For a stroke, you need medical help as fast as possible to avoid further damage to your brain. 5. Excessive headache. Hemorrhagic stroke can cause the blood to pour into the brain, leading to sudden increased pressure on this delicate organ. People who have this type of stroke complain about have severe headaches and a change in mental status. 6. The body goes numb on one side. A person who is having a stroke might notice one side of the body going numb. The affected person would feel difficulty in raising an arm or a leg. If this happens, make sure to head to the hospital immediately without any delay. 7. Sudden dizziness. During a stroke, it is a prevalent sign to feel lightheaded or dizzy suddenly. This can happen without any reason, and even if you had been eating properly. In such a case, call for medical help and get yourself treated. Other possible, less frequent symptoms of a stroke in men and women: sudden nausea and vomiting, hiccups, pin and needle sensation anywhere in the body, memory loss, behavioral changes, muscle stiffness, blurred vision or trouble in one or both eyes, difficulty in swallowing, involuntary eye movements, shortness of breath, pain in the chest, confusion, pain in the face and limbs, convulsions. In closing, stroke is an extremely severe condition regardless of gender. People who tend to smoke are high risk of getting a stroke. The causes of stroke can be limited and controlled by making the necessary lifestyle changes. A person can reduce the consumption of alcohol, smoking along with incorporating a healthier diet to lessen the chances of this deadly condition. Even a few minutes matter a lot in treating stroke. Again, remember the acronym FAST to recognize the symptoms of a stroke and ensure that the affected person can get urgent treatment. Do not waste time calling a doctor at home or driving to the hospital on your own. The ambulance workers have better knowledge about the situation and will try to get you the best treatment possible. A person who is having a stroke is immediately taken to an emergency department and seen by a specialist. The ability to determine the exact type of stroke and restore the blood supply to the brain can successfully increase the chances that stroke patients can be rescued and any damage to the brain can be minimized. So, speeding up the process to consult an expert can make a huge difference for you. The sooner a person receives the treatment, the more the chances to recover.